to go off of Colleen's wonderful presentation on wellness the last time. So let me share my screen. Okay, can you all see my presentation?
Yes, ma'am.
Yep.
Present.
Okay, can you see the regular presentation or presenter mode?
It looks perfect on our end, presenter mode.
All right, perfect. Okay, so we're going to talk a little bit today about telehealth and tips, and we've already talked about some of the frustration that we're coming across with telehealth, and I think we're coming across some waves of different pieces, and it seems now that everybody is kind of utilizing it a lot more. Access seems to be getting a little bit harder as well. And so figuring out different ways to serve such a large population has really been the most recent barriers. But telehealth came along, I feel like we moved right into telehealth. We were doing telehealth for a little over a decade now, but when the pandemic hit, everyone seemed to move to telehealth, right? Like we had to find a balance. We had to just pick up and keep on moving and find a way to move. And telehealth seemed to be that option. And so there are a lot of benefits to utilizing telehealth, and some of the benefits that we've seen, and I'm sure that you all have seen this, is naturally we can go outside of some normal hours. So we see extended hours in the morning and in the evening, being able to touch individuals who are in rural areas. So to reduce that burden of traveling, to help families from traveling with kids, right? So we're reducing that. We're also serving underserved populations. So in areas, with West Virginia being as rural as it is, many areas don't have specific providers for different targeted populations. And so now we're able to kind of hit those specific targeted populations, and also to help individuals who are chronically ill and have health issues who can't get out of the house. In psychiatry, we're able to help a little more of the individuals with agoraphobia who have that fear of leaving and such high anxiety about leaving. So now we're able to kind of get in there. And then during the pandemic, we saw, of course, the opportunity to provide services while individuals were sick, right? Screening for COVID to make sure that they're safe, and other diseases. So even now, I mean, we did this during COVID, but even now, individuals that I see, they'll call and say, my kid's sick or I'm sick, can we switch it to tele? And so we very much appreciate that too, so that you're not coming in and getting us sick, or the same, right? Vice versa, providers are sick. I've been struggling with migraines recently, and I'm like, I'm really struggling with a migraine, so I'm just going to work from home, dim my lights down. And so that's been nice. That's been kind of a nice flow. And so we see that on both ends, and you'll see that with providers too. A lot of new research coming out is identifying that providers prefer the opportunity to really be flexible and work from home as well. And so many places are trying to accommodate that, and even that flexibility with it. I know it's super flexible, like I'm presenting from home today, but I started in the office this morning, and it makes it so nice because this way I can be home and take my daughter to sports and get her the places I need to. So it really has been super beneficial throughout. So when we look at telehealth, I'm going to talk about, when I put this presentation together, to talk about, telehealth and setting it up and the needs. I come from working with children and families, so that's my perspective. But you all, and many of you work with children and families, but you can all transition this to adults too, so you can see where you can easily transition that. Sometimes we cover all of our bases with kids, so then you can minimize some of it for adults. But with telehealth, when you're looking at providing telehealth, of course you want to see that there's a need for the population that you're serving and for yourself, right? There are specific populations that I work with that they're not going to go without telehealth now. That's all they're going to use is telehealth. And so you have to identify that specific need and assess the appropriateness, right? Are they knowledgeable about electronics or telehealth or setting that up? Do they know how to do that? For some of my specific treatment, we need 2 devices and earbuds for our treatment. And so if we don't have that, then it kind of makes it difficult. If that's all they have is 1 device, then we'll figure it out. We'll work with it. But sometimes we have to make sure that people are knowledgeable. I know when the pandemic hit, I was super excited because I do a lot of PCIT. PCIT already had a curriculum that was developed for telehealth. So they were already doing telehealth with PCIT. So I was so excited because I was like, yes, like I have all this curriculum set up for me. I'm just going to move right into it without the anticipation that my families were not prepared for that, right? My families were not knowledgeable that I was working with of how to manage that or being able to access their internet or having a stable connection, right? So when I was all geared up and ready to move into it, my family struggled to keep up with me. So we did lose the first couple of families that we were working with during the pandemic, just because one got very frustrated with using technology and electronics and they discontinued services, and the other one just could not get stay connected, and they had such a difficult time staying connected. And soon after that, we saw a lot of funding come about for individuals to obtain that, which was nice, and they came back around. But we have to make sure that they have that knowledge. And even now I have some families that I work with telehealth with, and we do have to spend some time going through this and setting it up and showing them so that they don't get frustrated, because if we don't take that time initially up front, they're going to get frustrated and we'll lose them. So taking that time and making sure that we're helping them kind of set that up, making sure that of course it's appropriate diagnosis and that there's not dual diagnoses that are so severe that that telehealth would not be beneficial. If you have somebody that is chronically suicidal and you're needing to assess that and identify what type of state they're in, telehealth can make that really difficult. Makes it difficult for little toddlers. I try to at least do our intake in person so that I can get an accurate observation of the little one, because it can be very difficult with telehealth. Even my infant mental health and watching and observing those interactions between a parent and an infant can be really difficult if you have a parent that's trying to hold a phone at the same time. So setting that up is important, and then making sure that the diagnosis and services you're providing is appropriate. And then medication too. So making sure, especially with medication, a lot of the times vitals need to be taken. Individuals need to be screened in a specific way. So sometimes they have to come in as well. And so that would not be appropriate for telehealth. And we'll go over the safety aspect, but yeah, definitely enhancing patient safety. Remembering that we can't, at least when they're in our environment, we can control our environment. We can't control their environment. So we definitely have to prepare for those safety pieces and be ready for that. Now, for all of my telehealth sessions, I kind of take some time with parents and families for room setup. We talk about and discuss how to set up room and what their space looks like, and having a consistent space for our sessions, so that they're not running all around, and so that they're able to kind of limit the distractions, especially for kids. A lot of the kids we see have some hyperactivity. They're easily distracted. They have difficult behaviors that they're trying to manage, and having a lot of stimulation and distractions around can be very difficult during session. So we talk about that, making sure that there are age appropriate toys, because a lot of the sessions that we work with, we utilize toys. So if you're not using toys, you don't have to worry about that. But we talk about specific toys and what specific toys to have around. We don't set up in a playroom because there's too many toys. It gets overstimulated. So we make sure that we have what's needed. And even when you're not doing play therapy, even other sessions. I do a lot of activities with young kids, worksheets, coloring. I'll let parents know ahead of time, these are the supplies that we'll need for session today. And so my parents now, they'll ask me, are there any supplies that we need for session today? And so I'm able to tell them. But by preparing them, the more organized we are, especially when we're working with kids and families who are disorganized, the better off they are. And so sometimes that can be really helpful. And having support people there if you need them. Naturally, we're not in a position where we have providers there. When we did telehealth in a school-based setting years ago. So before I was at WVU Medicine, we did telehealth in a school-based setting, and we actually had a provider, so a school nurse there that helps set us up and get everything set up. And so now when I'm working with kids, sometimes it's the parent or it's the other parent, or it's us walking them through that. And so, if you do need that provider. And safety with kids, especially making sure that their seats are appropriate. If we're doing family therapy, making sure they're not sitting next to the sibling that they're going to get in trouble with, right? We know that as adults, we don't sit next to people we get in trouble with. So we try to keep the same thing going for our kids, making sure that their chairs don't have wheels, they'll wheel across the floor, and that they're in an appropriate place. I had a kid one session, this was like, it was so interesting, but he just got mad, and this was a safety issue, and we should have set up this room better when we first looked at it. But we were typically in another room, and mom pulled it in the kitchen, and he sat in this chair that was like right in front of this. They had all of these like papers stacked, books and papers, like bills and things like that. And he just reached behind him and started wailing them across the room right during our session. And so naturally that became a safety concern for everyone. And we talked about that. And mom was like, man, this really is a learning session where I'm learning how we need to set this up. And I was like, me too. So sometimes it is trial and error, but trying to eliminate that as much as we can beforehand can be really beneficial. A lot of the times, conducting session in a room where there's doors can be beneficial. Part of our treatment is we do timeout at some point. And the last one kind of talks about safety around timeout, but we do timeout. And so keeping the door closed is really beneficial, because I had one session where we completely spent our time with dad. So like I said, we had two devices, one that faces the child and the parent, and then the parent usually keeps the phone in their pocket so that they can have the earbuds connected to it. One session, the parent, all I could hear was them heavy breathing, because they're literally running around chasing the child, right, who ran and hid under a bed. So they're, and I can't see anything. So just making sure that we had a door was really helpful, and making sure that it's secure space. So setting it up so that it's confidential and private. I tell everyone, these are your sessions. So who you want in it is your business. I won't have people in our sessions. So I make them aware of that, but making sure that they're confidential. Who might be in your sessions? So we do explore that. Who would you see come across? Who's okay to talk in front of? Who would you like me to stop if somebody were to come in? So some of that occurs. And then, so just kind of setting that up, of course. Oh, hold on one second. So with groups, though, groups are a little different. So when I would set up rooms for groups, nobody could have anybody in their space. So we made sure that as far as confidentiality, everybody had to be in a private space. They couldn't have anybody, because then we couldn't control who they would see or who they would overhear. And it's our job to keep everyone's information confidential. So groups were a little bit different. And then just some tips for engaging in telehealth. So I'm sure that you all have come across a lot of different tips and tricks and how to engage people. But these are some of the ones that we typically use to engage when we're doing groups or family therapy. Popcorn is really beneficial. So popcorn is just choosing somebody, right? So you have your list of people there. And instead of putting something out there, you know, in groups we're putting things out there, topics. Has anyone ever experienced this? You know, you're going to get dead silence most of the time. So if you popcorn it, it can be really beneficial. So you might say, Elizabeth, have you ever experienced this? And then have Elizabeth pick somebody next to her. And so then by calling directly at individuals to participate, you can popcorn them, and then they can choose one another. And so that can be really beneficial. I've gotten mixed reviews on that. Group members really haven't given me such a hard time about it. Some don't like being called out on it, but some prepare and know that they're going to have to participate. So it can be helpful. Activities, like I said, especially working with kids, I've always had activities during telehealth, especially our ADHD kids. They have a really difficult time staying seated, staying focused. And that's another piece. You might want to have ground rules of how they stay seated, what's appropriate, telehealth etiquette, right? So like in groups, we've had to talk about no smoking on camera. It's just like if you were in the office. So like no smoking, no inappropriate things hanging up behind you. You know, when we first started telehealth, we had it was during the elections, so all kind of political signs behind people. And so we just had to make sure that everything's appropriate. And for kids, kind of the same thing, right? That they're seated, that they're not running around. I tell the kids all the time, and it kind of does make me sick, but I tell the kids all the time, I'm like, oh, you're making me sick, you're running around. And kids will sometimes then stop, right? I have one that I still see through telehealth, and in just the first 5-10 minutes of our session, he's just constantly going everywhere, and he out of excitement. That's a nice piece of telehealth too, is we got to see a lot of people's homes, some of their favorite things. We got to incorporate household items, pets, siblings. So that's kind of been nice too. So activities around that is helpful. Breakout rooms, so utilizing your breakout rooms for smaller groups, and then coming back to bigger groups, especially for family therapy, right? If you could break off into dyads and coming back. The same thing for group therapy, kind of breaking off into smaller discussion groups and then coming back to the larger discussion. That's a great way to engage individuals. Using your whiteboard feature on Zoom can be helpful, like drawing out, making lists, putting out what they're talking about. Kind of like just using a dry erase board. And then movie clips, right? Like so kind of breaking that up and showing some clips, some scenes, that can be really helpful too. So when we're safety planning, you know, like we talked about, we identify, you know, the location where they're at. So that's one thing that we do with telehealth is we identify exactly where they're at each time. We have to, one, for billing purposes, right, that they're in West Virginia, but where are you at? You're in your car. You're in your car where, right? And we do this so that if something were to happen, we know where to locate them and we know where to get them. So it's really important to find out their location and where they're at each and every session. Who you can contact if you disconnect. So can I still just contact your cell if we lose services? Yes. Is it a private location? Is it okay if somebody walks in? Like we talked about, who can walk in? Do you want to continue session if people walk in? Do you want to, you know, do you want to tell me, no, we'll stop? Do you want to just let me know as it comes? And so kind of setting that up ahead of time can reduce that awkwardness of when that comes about. And then using a safe word sometimes. So if they're, you know, if especially if there's been domestic violence, I've had a couple cases where there's domestic violence, and it makes it really difficult to talk and to feel comfortable talking and saying things. And like we're kind of trained to pick up on that, and I could quickly tell when that changes, right? But just making it safe for some people, like what is your safe word? What can we say if you start to get uncomfortable, if you're not able to talk, or if it is unsafe, right? So kind of differentiating between that. We talk about how we'll handle it if you're uncomfortable and you don't want to talk, but then how we're going to handle it if you're unsafe. And so we talk about that and how to manage that. And we definitely have come up with some safe words, and we've had some patients use some safe words, especially like I said, our families with domestic violence. but having that safety plan, having police information, hospital information, emergency contacts with our release of information. And so talking about this ahead of time helps us to kind of set that all up and helps us to get those appropriate releases of information to talk to those people that we may have to contact throughout this time frame. So it's a lot. It's a lot of planning, preparation, and then engaging and doing all of that. I mean, we've learned and studies have showed that doing all of that through telehealth has really started to wear individuals down. And so that's where we want to talk a little bit about wellness and just being aware of compassion fatigue, right? And compassion fatigue is just the decreased ability to cope with the everyday environment. And so, a lot of the times, if you look at this little graph, you see like burnout and secondary trauma, and STS is real, and we deal with a lot of secondary traumatic stress. We talk to individuals with highly stressful situations, and just like I'm talking about with domestic violence, right? Like that's a situation where we might respond to a crisis at that moment in time and deal with this highly stressful situation, and then not really take care of ourselves afterwards. So it's really important to be aware of how much stress we're dealing with individuals and how we're taking care of ourselves as well, because it's really important, especially when we're doing telehealth, because we're doing even more, right? So a lot of the research and study has identified that, especially in mental health, right? When you're providing mental health services, many of us are, we've talked about this before, many of us are helpers and doers. And what happens is you become very limited doing telehealth. You have to engage through the camera. You have to look at the camera and then look at individuals. You have to make more of an effort to pay attention to their nonverbals and what's going on with them, where when you're in a room with somebody, you can kind of feel that, right? That's what we're taught. We're taught how to handle some of those nonverbals in person, but not over the screen. And so that can wear us out even more on top of some of this high stress that we're really working with. And so paying attention to that is really important. Burnout is real, right? Burnout takes a toll on us as individuals and our bodies. And so really looking at how motivated we are, like what's going on with us, if we feel like fatigued or depleted all the time. And then I love this little cartoon of the burnout. And it shows this one where it outweighs, like, do the demands of your job outweigh the resources and ability to cope, right? We know that if that happens, then you're going to burn out. It's more likely that you're going to burn out. And I think that there's so much literature after the pandemic that has come out that supports this, that a lot of people, and I think the increased need of mental health providers too has helped institutions to really look at this. And I know our institution has started to look at this. And I actually stole this from Jenna Mosley alone. She's presented on here before, and she's a real advocate for compassion fatigue and burnout. And she's actually developed a whole proposal for our institution on how to manage with our providers and kind of reducing some of the caseload and what we're looking at that time to help support that, so that these resources, where we see if our resources outweigh, so that we have those resources for individuals who are burning out, and that we're providing support instead of pushing more their way, right? Because that's important. And it's hard. We have a job to do. We all have we're all going in a million different directions. And so it's really hard to slow down. Sometimes it's hard to slow ourselves down, but then it's sometimes even harder to get our organization to see it, that we need to slow down. And so I think that organizations are starting to really identify this need, or else we do lose people. When you're conducting telehealth, so paying attention, like I said, to yourself. So keeping wellness while you're conducting telehealth. I know for me, and we've talked about this throughout on these echoes. But I know for me, when I started doing telehealth, I had to set specific hours, right? Have a specific transition for myself. Our spaces were limited, and so many times individuals were taking over some of their safe spaces. So identifying that space and specific time, I would work during the pandemic. I would work sometimes until like 8 o'clock at night because I just didn't pay attention, right? Like you just got busy and you just did things. So I had time frames where I would specifically make dinner and get up and leave and be done with work, right? And I still do that when I work from home. Well, my daughter's schedule now, but like our kids do a good job of keeping us busy too. But that way I know I'm done, right? Like I have to take her, or I know that I can take her and come back, do and have like 2-3 items that I need to do. Once those are done, then I'm done, right? Like, so I have to set that up for myself, or I'll just work. I'll work until it's dark and I'm ready for bed because I just won't pay attention. So being aware of that is really important. Identifying that schedule. Take walks. So getting up and taking walks, going up and down your stairs, going and switching a load of laundry, right? So you're not sitting in one space the whole time. I mean, I could say that for the office too, taking walks, because now we're all on our screens in the offices too. So a lot of individuals around in our space have identified their daily walks. And so we take walks in between, and there's some groups that take walks in between. Like I was saying, limit your time, limit your caseload, reduce your caseload, and pay attention to what caseload you're taking on. I have one supervisee that I work with. I talked to her about when she's doing tele, not taking on all of her heavy trauma cases, right? It can already be exhausting. And then taking on some of that secondary traumatic stress is even more exhausting. So we talk about ways to kind of manage that and lighten that a little bit so that she's not doing that. Sometimes the schedule is not always that flexible, but trying to do that as much as you can is beneficial. Resting your eyes and using blue tint is really important when doing a lot of telehealth. My eyes get like blurry by the end of the day if I'm looking at the screen all day long. So I have to, but making sure you're resting your eyes, not sleeping, but just resting your eyes at times. And other self-care items. A lot of different wellness includes relief, rest, and revive, right? So there's some assessments, and we'll talk about one at the end, but there's some assessments you can take to kind of relieve some of that. We talked about consider your dosage. So regarding your caseload, we talked about looking at different types of targeted populations that you see. Insert some extra supervision or debriefing as you need it. Time to process. So when you're doing telehealth, sometimes when you're working from home, you don't have that time to process with people. Like I'll just go and sit in someone's office, right? So making sure that you have that time to process. Now what I've started doing is I FaceTime people. So we FaceTime and we kind of process. And so making sure you're setting up that time that you can process. Providing more support to young and new staff. I know our onboarding is now identified really starting. I mean, we've always kind of had this like ramp up thing with cases where we take a slow approach to providing all of their patients. But we really have taken that ramp up part very serious so that we're providing more support to new staff and making sure that they're able to kind of meet those needs. And then self-care. So capture your values and beliefs on a good day, right? Not on a bad day when you're exhausted and you're like, oh, what am I doing? Like, what is it I want to do? What do I value, right? So not doing that on a bad day, but doing it on a good day. Receiving therapy yourself. I know there's still some stigma around that, which I think is silly, but everyone could use that. And counselors have to do that as part of their curriculum. Social work, we've never been required to, but I think it's a beneficial piece, like receiving your own therapy. Somebody was presenting this before, it might have been Jenna. But this part really hit me. Mindfulness, pay intentional attention to the opposite of your hard, right? So this one, I was like, ooh, yeah, like the opposite of my hard. So like my hard of like what's difficult for me and what the opposite is. And so for me, like the opposite of my hard is like play. I love playing, which is probably why I work with kids, but that's the opposite of my hard. So start paying intentional attention to those, that time and that time with my family and that time. So that helps reduce stress for me. Transition rituals, like I said. So if you're working at home, like transitioning to dinner or transitioning to doing something else, so that you have this ritual that kind of separates the two. So using transition rituals. This is also good when you're working with kids for behavior management. Talk about it, the good and the bad. Talk about both. Remember your wins. So, and remember, sometimes our wins are small. And so really reflecting on some of those wins and remembering them. Self-compassion, just having grace and finding grace with yourself. We don't have to know it all. We're not expected to know it all. And so finding that grace, and then playing. So there's all kind of different types of playing for adults, and there's different ways to just kind of release some stress, right? Joking around, some physical pieces, right? Like yoga and aerobics, exploring, collecting things, storytelling, whatever it is that you enjoy doing, making sure that you're doing that, and having fun doing that. So this is, the ProQool is an assessment tool. So here's the website. You all can get on. I'm not going to make you get on together, but I want you to get on. It's really cool. It assesses the negative and positive effects of working with traumatic stress. And then it also has like some subscales for compassion, satisfaction, burnout, compassion, fatigue, but it kind of tells you where you're at, and you can actually utilize this tool to identify, like, if you are burnout, where you are and what you can do to kind of help that. And so it really helps us kind of gauge where we're at with all of that and what's going on with us. But so those are my tips and tricks for telehealth, and just some quick wellness pieces that come along with that, because it does get very exhausting.
Thank you so much, Amanda. It's always so nice going through anything telehealth, because it is like life right now, after COVID and stuff. And I can't even imagine as a provider having, patients through telehealth like you went through. But I commend you and all the work that you do. It's definitely not easy, but it's superhero work that you guys do. So thank you so much for presenting that. I really love the burnout diagram that you had there too. And did it say like 1970 something the term burnout was developed? Something like that. I was like, I don't know why that surprised me. I was like, I feel like the term burnout has been around, but like since the 70s, it's crazy. So
yeah, it's hard to think that it's been that long. And I think you're right. Like, I think these things they're definitely nothing new. Nothing I went over today is anything new, but it's always nice to have these reminders and to remember to slow down and to take care of ourselves, and how important that is, and how we can do that in a way where we're identifying what's going on with us.
absolutely. Yeah. Thank you. Any questions, comments from the group? Maybe your personal experiences with telehealth and all that comes with it. And I know for Elizabeth and I too, when we transitioned to when COVID hit and stuff, transitioned to all like online things, like you were saying, Amanda, finding that set schedule and making sure, like, by the time it could be dark out, it could be 8 p.m. and you're like, shoot, I need to go to sleep now. But it's so hard to find those boundaries. And some personalities, like being a workaholic, you're just like, no, I can push through another email or another task, and it just leads to burnout too. So absolutely.
Yeah. And the unfortunate thing during the pandemic too is we all had shared space, right? So if you had kids too, then you're managing homework and dinner and everything else. And some people have talked about like it taking away from their shared space. Like, I think at first I was working a little bit in my bedroom, and like I never wanted to be in my bedroom, and my bedroom was like my safe space. So yeah.
Absolutely. That happened to me too. I was like, I despise my bedroom now. Teresa chatted in, one thing that helps providers is having a completely separate room for their office. That's absolutely true.
Yes.
Yeah, that is absolutely true. And what are your recommendations if someone doesn't necessarily have, and Teresa, please chime in as well from your experience, but what are some recommendations if like you don't really have much, like going to a cafe or like, some other space that you can find, but some folks might have like even limited space to, find a living room if they do have kids or a spouse who's at home. Yeah, I'm curious.
Well, during the height of the pandemic, I was in K-12 education and lived in a small house with a lot of people. And so that first quarter from March to the end of the school year was horrible. It was just absolutely horrible. But what I was able to do the next school year was I worked it out with my school system that, I mean, the building still had to be open. So why couldn't I be at the building? So I was able to go to work and no one else was really there. I think there were like 5 of us in the whole building. But if you have those issues where there's just not the space at home, then you might be able to work it out where you can go in and work from the office with nobody else really being there.
Yeah, I think a lot of people were able to schedule time in the office if your office allowed it, if the buildings were open. I think that's a great recommendation, is finding a separate space. But when you don't have it, that is hard. And I think especially for our services, I mean, a lot of our services have to be private and confidential. And so we have to find that space. And if we don't find that space, we can't conduct it. But I think the transition pieces, like we've talked about, are really helpful for that too. Like even when I had that shared space, like having that transition was helpful. Like removing all of my work items from that space when I was done is helpful, right? Like packing up. I mean, even though we weren't going anywhere during the pandemic, packing our things back up and putting it in our bag, right, was really helpful because it was like out of sight, out of mind. And it sounds silly, but those visuals are very helpful.
Absolutely. Thank you both so much. Any other comments from the group? And I'll be sure to add your slides in the recap email as well, Amanda. A lot of great diagrams and images in there.
Thanks, everyone.
Thank you so much, Amanda. Again, we appreciate your time and sharing all that information with us. And I'll certainly be utilizing some of those self-care and compassion outlooks as well for myself. But so next time Dr. Lillard is up to present and we were chatting, she wanted to get all of your input on what you'd like to hear her present on. So if you have